Hello, today we're going to talk about the functions of a PT and a PTA. So we'll discuss a little bit the differences between the two, but also how they work together and complement each other in their duties. So I'm going to talk about the PT first, and one of the things I do is the examination and evaluation. So these are going to be things that the PTA will not be doing, however, may be assisting in doing parts of these things. So the PT is going to look at the patient as a whole. They're going to look at any history of the current illness, but also history as far as any other medical issues, or if they've had that same condition before. They're going to perform different tests. They're going to look at vital signs. They'll look at their strength. They'll look at their range of motion, their gait, their balance, how this patient moves functionally. So can they get in and out of a chair, on and off a toilet, in and out of bed, those kinds of things. The evaluation is written up with results of the examination. That PT will then designate a physical therapy diagnosis, which is actually the next slide, but they'll kind of determine whether PT is appropriate for this patient or not. And if not, they may refer that patient back to the doctor or to maybe a different discipline, but this is where that patient, or the PT, will say, okay, this is what we can do for this patient. So the diagnosis is that PT diagnosis. So you're going to look at the things, or the PT will look at the things that are appropriate for the PT to treat, or what is appropriate for that patient to be treated for in physical therapy. The PT will not diagnose something like diabetes or a myocardial infarction, but they may look at some of the results of those things. So it may be weakness, it may be decreased balance, it may be, decreased strength. And the prognosis is the expected outcome. So the PT will kind of make an estimate on how long this patient may be in PT, how many treatments it may take, and what their expected outcome would be. Would it be complete independence in the community? Would it be increased strength to a certain level? Would it be improved functional mobility to allow a patient to live at home alone? It could be a lot of different things. Then, when the patient, or PT, puts this all together, they determine a plan of care. So this plan of care can include just about anything. So you're looking at different modalities, any sort of manual therapy, therapeutic exercise, it could be gait training. It always includes a home program for the patient, whether it be certain stretches or exercises or other things. But education of the patient is very important. The PT will usually set long-term goals and short-term goals. So within this week, we're going to be at this point. By the time of discharge in 6 weeks, we want the patient to be at this point. So it gives the PTA a good idea of some of the progression for that patient as well. Responsibilities. So PTs are responsible for the PTA. As we learned through the Practice Act, the PTA has to work under the supervision of a physical therapist. That means that PTA works under that PT's license. So it's up to the PT to determine when that patient can be seen by the PTA, what that PTA can do. It all depends on obviously the PTA's experience, the PTA's skill level, some of the continuing education they've had, and then for each and every state, the laws and practice acts may be different. So it'll also be the PT's responsibility to determine when a reevaluation is necessary, when they may be revising the plan of care, or when that patient might be discharged. Okay. The PTA used to be all this stuff, but the word that's important, it is at the bottom, is a paraprofessional. And that comes straight from the APTA website. And a paraprofessional is considered to be someone who's not necessarily licensed and may not even necessarily gone through an accredited program. But they're trained and they're qualified to do a professional examination to allow them to work this way. As of today, all states in the United States require licensing for PTAs. They do require licensing. There's still a couple states that just require the certification, but that still means that you need to go through a CAPT accredited PTA program. And CAPT, I think we've discussed before, is the Commission on Accreditation in Physical Therapy. They're the ones that do accredit all programs to make sure that they are in compliance with all the standards set by the APTA. So the updated definition, this is kind of what I just talked about, is now that PTAs are a graduate of a physical therapist assistant program. They have at least an associate degree, and that program is accredited by CAPT. We've had students that were in PTA programs, and these PTA programs lost their accreditation. So what happened then is those students could not sit for the licensing examination. So there are several schools out there that are not accredited. If you're not accredited, you cannot sit for the licensing exam, and that's very, very important to know. Now, functions of the PTA. Again, they work under the supervision of the PT. They perform interventions, and interventions can include modalities, exercise, education, just about anything. They will perform tests, and this is part of that assessment. So they're not doing the evaluation that the PT did, but they're doing some assessments, whether that assessment be checking range of motion every treatment, or checking their strength after 6 visits to see if it's any different or any better than their first visit. It also allows the PTA to determine if an intervention needs to be modified. So whether that patient responds positively or possibly negatively, that PTA will determine or can modify whatever that intervention is. And we'll talk a little bit more about kind of the scope of practice involved with modifying an intervention. Documenting patient's progress. So you'll document that through a SOAP note, which again we'll go into more detail in a later lesson, but the SOAP stands for Subjective, Objective, Assessment, and Plan. So in this note you'll determine or document that how the patient is progressing. Under O, it's what you've done with that patient, what you may have assessed with that patient, what you observed with that patient. The assessment is a little bit of an assessment of how you feel that patient is progressing. Are they working towards their goals? Are they reaching their goals? And the plan would be, what are you going to do next? So is it the next visit, or is it in the next 2 weeks? Whatever that might look like for that patient. Okay. The other scope of practice is, as long as you're not treating a federally funded patient, you're able to practice with general supervision. So even if the PTA or PT gets called out of the office, say to a satellite clinic, but that PT is available by phone, you can still treat that patient. But otherwise, the PT does need to be on the premises. In the state of Washington, and this could be changing as we speak, is that the PT needs to reevaluate the patient every 5th visit. So basically, the PTA can treat that patient 4 times, and then on that 5th visit, they need to be seen by the PT. Now, this has been probably determined differently for different clinics and different companies. So our PT board for the state of Washington is working on the defining this a little bit better and kind of laying out more specifically what this means. So stay tuned, because we'll be able to give you more information on that soon. You can perform peripheral joint mobilization with appropriate training. So peripheral joint mobilization is not considered an entry-level skill for the PTA. However, our clinicals and our employers are expecting our students to know that. So we do teach it, but to go any further than the peripheral joints, you definitely need continuing education. And then the other function of the PTA is making sure you communicate with the PT when it is appropriate. Again, depending on the patient's plan of care, that may or may not give the PTA a certain amount of freedom, and often that depends on your experience, your education, and also the trust that that PT has in you and your skills. Okay. So, the PTA cannot evaluate, develop, or change the plan of care or the treatment plan or the goals. It is outside their scope of practice. They cannot write a discharge plan or a summary. Again, that has to be done by the PT. And these summaries or these plans are sent to insurance companies and physicians, and that's why they need to be done by the PT. In the state of Washington, PTAs cannot perform sharp debridement. They can do use things like there's certain lavage kind of things with water that helps to breed wounds, but they can't use things like scalpels or tweezers on wounds. And then with joint mobilization, again, like I said, is not an entry-level skill. However, more and more PTAs are learning joint mobilization in their programs. What you cannot do as a PTA ever is a joint manipulation. That is only done by the PT. Okay. I'm not getting the whole slide in here. Sorry. CAPTE. So this is the accrediting body that evaluates the quality of education programs. So what they're looking at here when CAPTE comes in to do an accreditation visit, they are protecting the patient. They're protecting the customer. They want to make sure that we are in a safe but also effective program to be teaching PTAs. Okay, and yeah, they'll evaluate every PT and PTA program every 3 to 10 years. They are separate from the APTA right now, but they also, this accreditation, like I said, allows the graduates to sit for the licensing exam. So, as far as how the team works together, you know, it's one of those relationships that you have to build a PT with a PTA, and respecting each other, giving suggestions to each other, providing feedback, and really getting on that level to be able to work really well together. The PTA will carry out those duties that are designated by the PT, but also will give them feedback on how things are going. To be on the same page, you know, with your PT only helps the patient. It obviously makes it easier to work, but you get better continuity of care for that patient. And the education piece is that you're always teaching each other. You may be a, you know, brand new PTA working with a PT that's been out of school for 20 years, and there's so much to learn from each other. And then there were some videos that you can watch on your own, but as for now, that's about it for the functions of the PT and the PTA.